Hi, I'm Dr. Joseph Lee, a licensed clinical psychologist at Crossover Health. Thank you for taking the time today to join us on our ADHD Be Well domain. I want to welcome you to this section, which will cover the common medication interventions for ADHD and differential diagnoses. I've invited Dr. Ruth Shea and Dr. Mehek Chopra to share their expertise on these particular areas.
Hi, I'm Dr. Ruth Shue. I'm a psychiatrist currently at Crossover Health.
Hi, I'm Dr. Mehek Chopra. I'm also a psychiatrist at Crossover Health.
Welcome, Dr. Shue and Dr. Chopra. Let's jump right into it. All right, people might have some questions about medications and using medications for ADHD. What's the most important thing somebody should know when they're going to see a doctor and wanting to get prescribed medication?
So medications for ADHD are not always started right away. We often want to really make sure this diagnosis is accurate, so it might take some time for us to get to know you, for us to do some more thorough testing. But you can always start with optimizing other strategies around focus and attention through therapy or coaching.
Oftentimes I hear people saying, oh, I want to get a stimulant medication. Can you help us to understand what is a stimulant medication?
So a stimulant medication, depending on which one is chosen, generally works on a neurotransmitter in the brain called dopamine. And it helps kind of increase the level, which is what we usually need when someone has inattention or difficulty focusing, concentrating. So they work in various ways in terms of how long or how effective they are, depending on the dosing.
So it sounds like then stimulants may be the best choice of medication for somebody who has ADHD.
Not necessarily. I guess we would say it's not necessary because it depends on a lot of other medical, history questions that we need to take before starting a stimulant medication. There are some side effects that would be concerning, some pre-existing conditions that would contradict starting a stimulant medication. So we would need to have a lot more history before we do start a medication.
Are there some dangers to consider or some factors to consider between using a stimulant medication or some other type of medication?
Sure. Stimulants have side effects. They can keep you up. You can lose your appetite. They can worsen anxiety. They're abusable. They're often misused and diverted in the general population. It's something that, while it's a treatment and a very effective one, we also take very seriously.
Okay. So if not a stimulant, then what other choices would someone have to use if they want medications to treat their ADHD?
So there's a whole nother class that also increase the dopamine and norepinephrine, which is what stimulants do, in a different function. They're called non-stimulants, and they don't carry the same risks or quite the same side effects.
Well, I've heard of non-stimulants, but I'm not quite sure what they are. Are there common names of these types of medication?
Yeah, a few of the common names are Intuniv, Wellbutrin. Those are probably the two most common ones that you come across.
Okay. So what would be the most important thing someone should know when deciding between using a stimulant or a non-stimulant medication?
That there's just a lot of factors that we would discuss with you specifically to your situation, to your background. And it's something where, while you might read about stimulants in the popular culture and your searches, that might not always be the best option for you.
Okay. Great. And then one other question, sometimes they don't get, or someone might not get prescribed a stimulant or a non-stimulant. They might not get prescribed anything at all or something completely different. Why would that be the case? Or what would be something that would come up that wasn't even thinking about that may seem very similar to ADHD?
I would say in terms of other diagnoses or their overlapping symptoms, it might be similar to depression or anxiety. But there's also, mood disorders such as bipolar or other underlying medical conditions that can contribute or exacerbate symptoms of inattention or focus, such as seizures, brain injuries, any, history of any brain trauma. So you have to kind of rule those out if those are a causative factor.
Okay. How would these other diagnoses present, like it would be a problem with attention or concentration or focus problems?
When somebody is symptomatic with another diagnosis, say depression, anxiety, concentration and focus are often one of the main symptoms of those disorders as well. In general, if your mental health is not optimal, often you can have trouble focusing due to other factors.
Okay. Well, thanks. I appreciate you taking the time to share with us from your knowledge. And thanks again.
Our pleasure.
Thank you.
And if you feel like some of these information applies to you, or if you have any questions, please consider reaching out to Crossover Health for more assistance and assessment, perhaps, and perhaps you can come up with a treatment plan together.